work as much as possible. That's strength and weakness both.
Don't you think this sounds very fancy and complicated?
Minimal invasive surgery.
Do you have to be a surgeon and a video gamer at the same time?
So the recovery is faster, patient can get back to his professional work. Or
I think this would make a really big difference in people's life.
proper strengthening exercise and mobilizing exercises is the key to get back to the normal work.
So is there any secret routine or fitness that you follow?
And any sport I play, I will do warm up.
So welcome to the program, Doctor, and it's a pleasure to have you.
Thank you, Dr. Lakshmi.
So why did you choose, or what made you choose this field, that is orthopedics, and your love towards shoulder arthroscopy? What's the story behind this, Antaru?
Orthopedics, it's because every case what we operate is a different challenge. It's not the same. If you take a trauma or if you take a replacement knee joints or arthroscopic surgeries.
So even though the body part remains the same, but the story behind it and the way we treat it, our approach is different.
Every day is new.
So talking about shoulders, Doctor, I mean, it's one of the most important joint in our body. We use it for everything from the time we wake up. So why do you think it is more prone to injuries, Kanavandi, or why do we get issues with the shoulder?
In Indian population, we see it like injuries related to the aged people. And active sports injuries are the next common thing, and degenerative things, aged, but because of the weakness of the tissues, because of the decrease in the strength of the tissues, they get injured.
So generally, in the age group onto the doctor, like someone who's affected with these injuries, or anyone can get it, Antara?
Elderly people, we commonly see degenerative rotatory cuff tear, Antaru. And in the young population, it's more of sports injuries or trauma.
So one is age-related, Antaro, and the other is the common sports-related.
Yes, or it can be like non-traumatic and traumatic. Non-traumatic is more age-related.
Any particular sports which puts the shoulder to this kind of things?
In any activities, like if a person is doing a wrong gym activity also, lifting weights in a wrong position, he can hurt his shoulder. And sports like golf, which wherever you use your shoulder rotation movements and power is required, in such cases you are prone for injuring the shoulder. In the swimmers also, and of course in the cricket, when the bowlers especially, they are prone for injuries.
So I think technically every sport, you need your strong shoulders.
Yes.
So we are here today to talk about shoulder arthroscopy. Don't you think this sounds very fancy and complicated? How would you explain this in plain language?
Shoulder arthroscopy is a minimal invasive surgery. It's like a daycare procedure, or one-day admission is good enough. And it's you can get the things done right with 2 or 3 keyholes. We pass a camera inside into the joint, and one hole we use it for the instruments and to fix the problem inside. So that's the reason there is less infection, negligible infection and negligible blood loss, and recovery is faster as we does not injure the tissues there operatively.
So let's say someone's got some shoulder injury or some shoulder problem. I'm sure they would Google it, and which is more dangerous. So what kind of conditions do you think would require this kind of surgery?
So shoulder arthroscopy, in our practice, what commonly we do is cuff tear. And second common is shoulder dislocations, which is commonly seen in sports people, and probably people who has lax tissues also. And third is we see adhesive capsulitis. It's a frozen shoulder. Diabetic, elderly people, who have already used medication and who have underwent physiotherapy. Still, it's not movement is not improving and pain is persisting. And few other cases, like if there is arthritis early stages and there is any loose bodies, could remove those things. And few cases like we have to take a biopsy, we have to take a tissue for the examination for the histopathology or cultures. Such cases also we can use arthroscopy, shoulder arthroscopy surgeries.
So you were mentioning, about the keyhole surgery and passing a camera. Do you have to be a surgeon and a video gamer at the same time?
Not video gamer exactly, but as a surgeon, this has a long curve. It's not easy to just start doing this kind of surgeries immediately. I myself personally have got trained with the senior surgeons and have been trained at Cape Town, South Africa for shoulder arthroscopies. So it has a good learning curve. You need to do quite a few, observe few surgeries and do few surgeries to master it. So that's the key there. And it's not like robotic or something like it's we visualize through the tiny holes through the proper cameras and we execute the procedure here.
Cape Town, that really sounds fascinating. So how is the life there?
Yeah, I'm lucky that I have worked with one of the world's best surgeon, arthroscopy surgeon. He, on my first day of my visit, he had a OP of 16, 15 people. That's big number in the Europe. And almost 10 people were from different countries, sports people. So with such kind of person, it was my pleasure to learn something from him and stay with them. And that's how I got trained
So
in
that was
initial
a
days.
spark and you developed love for shoulder arthroscopy, I believe.
Yes.
So talk about shoulder arthroscopy, doctor. How is it different మనం normal surgery or traditional surgery తో కంపేర్ చేస్తే మనకి ఏమైనా బెనిఫిట్స్ ఉంటాయంటారా?
With the small tiny holes, as I said, we do the procedures. The tissue damage is very negligible there. I mean, the normal tissues. So the recovery is faster. Patient can get back to his professional work or whatever job they are doing or household work. They can get back to their work and quickly. Then at least if you see arthroscopy surgeries, sports, they can go back in 3 to 6 months.
Oh, wow.
And whereas open surgeries, they may take very long time because the muscle to get the strength and to achieve the range of movement in the open surgeries, it takes a long time.
I think this would make a really big difference in people's life, getting back to their routine
Yes.
life and doing the normal stuff.
Yes.
So, is there any role of physiotherapy or rehabilitation antara post-surgery?
100%. To all my patients, I say, if I have to do a surgery for you, you have to, post-surgery, you have to listen to me, you have to follow up with me and do regular physiotherapies as your therapists say or as I suggest. If you don't do that, you have to think twice before getting a surgery done because it has a very good role. Physiotherapy plays a big role.
I'm sure చాలా మంది they ignore this physiotherapy part after surgery because most of us think, okay, surgery అయిపోయింది, I'm done with it.
Physiotherapy post-surgery, post-arthroscopy, shoulder surgeries is very important to get back to your routine works and to be normal.
Is there any best thing that you could do to your shoulder or any worst thing that you could be doing to your shoulder unknowingly?
In the early stages or middle stages, if you go for the physiotherapy in frozen shoulder, yes, it will improve. There's high chances of 90% chance of improvement. But still in the last stages, they go and ask for physiotherapy. And if someone continue to do physiotherapy, that will worsen the pain. They'll have sleepless nights and forcefully doing such physiotherapy mobilization can also cause fractures.
So tell us something about yourself, maybe some hidden talent that we don't know or some secret hobby that you love.
My hobby is driving long distance.
Oh, wow.
And work as much as possible. That's strength and weakness both.
So is there any secret routine or fitness that you follow?
I eat less, do at least 3 or 4 days workout and that's it.
So as an orthopedician, is there anything that you would never do?
Any sport I play, I will do warm-up, proper warm-up, and then I'll go for the sport. Even in the gym also, doing less weight or doing a proper technique is important than doing more weights. So that way I will take care as orthopedic.
And finally, what message you would like to share with our viewers out there as far as shoulder or shoulder health or shoulder arthroscopy is concerned?
Shoulder joint, as said, it's an important joint for any person, whoever in whichever profession it's there. So preventing injuring that for the sports people especially, we have to do the proper strengthening exercise, warm up exercises, and elderly people, that's sometimes it's a senile, it's age related changes that can be very well treated with the arthroscopy surgeries.
I think that's a very important point that you've brought up. So thank you, doctor. It was wonderful interacting with you, and thank you for an enlightening session on shoulder arthritis.
My pleasure. Thank you.
So this brings us to the end of this episode. Hope this episode was informative on the topic shoulder arthroscopy, and don't forget to tune in for next week as well. Until then, take care and stay healthy. Thank you.